Hi, I'm Dr. Yair Lenga, and I'm a periodontist in Midtown Toronto. So for the most part, dentists usually enlist the aid of a periodontist when they're starting to see breakdown in the attachment around a tooth. Now this can come in a lot of different forms. It can start off by being disease process around a tooth, red, inflamed, bleeding gums, pus coming from around the crown of the tooth, mobile teeth, or even painful teeth. On x-rays, sometimes we see that there's infections surrounding the entire tooth, so bone loss, as well as recession, and that's the exposure of what should be buried in the gum and the bone suddenly exposed inside the mouth. The other thing a lot of dentists will enlist periodontists help with is tooth loss. So either teeth that are known to be hopeless and need to come out, or teeth that have been taken out a long time ago. And so they enlist the help of a periodontist to replace or reconstruct an area for tooth replacement. So working with general dentists, it's incredibly important to start the treatment planning process right at the beginning. So when we've identified a problem with a tooth, whether it's disease, recession, or tooth loss, we want to be involved right at the ground floor in terms of designing the blueprint of where we're going to end up. Once we start to take out teeth or start to make replacements without a plan in place, that's when things fall apart. So we really ask that as soon as there's an issue that's been identified, let's start the treatment planning process together. Give us a call, send the patient over for a consultation, and we start the workup process. 3D digital x-rays, 3D digital scans, and we start to overlay all of this to design a blueprint that is right for the patient. I think the best way to deliver the highest caliber care to a patient is to enlist the help of a multitude of specialists. There are textbook approaches which a lot of people are taught in dental school about how to approach issues in periodontology or issues with dental surgery. But in specialty, you really start to learn the advances and the newest techniques in terms of provision of care. So what do I mean by that? Historically, when there was a tooth that needed to be extracted, it would be a multi-step process. The tooth would first come out. At that time, it may or may not be bone grafted. Oftentimes, if a tooth is infected, you would take it out, you would allow the socket to heal, patient would return for a bone grafting procedure, that would be allowed to heal. They would then have an implant placed, that would have to heal, and only after 6 to 12 months of treatment would the dentist start to be involved in making the porcelain crown. But today what we understand is that multiple surgeries create multiple areas of scar tissue. And scar tissue is actually the enemy of circulation, circulation being the primary factor for good healing. And so the field of periodontics has really moved towards immediacy of surgery. So at the time that we've identified a tooth that's hopeless, our goal is to extract, place, and replace that tooth so that we get a single healing event with the best circulation possible. From a dentist's point of view, the entire timeline from start to finish now becomes truncated to a third of the healing time. I think the field of dentistry is evolving so quickly that it's hard for anyone to stay on top of it. Specialists like myself are not here only to educate patients towards accepting treatment plans, but we're actually here to teach and to educate dentists in the community. So if you're encountering a question that you have about a patient, give a call, send an email, send us an x-ray by email. Let's review it together and come up with ideas. You just may be surprised at what's out there in terms of provision of care at the highest level for your patient.